New at 5:30, the summer spike in COVID-19 trends may be slowing down in Virginia. Updated models predict the virus has peaked in the state.
It comes as experts urge people to get booster shots to reduce vulnerability to the variants that are fueling those new infections. We have team coverage tonight. Janet Roach breaks down a new study looking at vaccine protection levels, but we start with Dan Kennedy. He's tracking the trends and explains when we could see a big drop in cases.
Statewide hospitalizations for COVID-19 today dropping to 759. That's down from last week when we were over 800 patients throughout all of Virginia. Looking at some of our local cities, there's reason for optimism here. This is Virginia Beach, 92 cases today. That's 3 straight days below 100 cases a day for the first time since back here in May. So we're going to see a drop in that 2-week moving average out of Virginia Beach. Newport News also seen a drop in that average, though back up today. They reported more than 70 new infections there. And this is a look at Virginia as a whole. Today reporting 2,770 new cases. So you're looking at that dotted line, the 2-week moving average, perhaps starting to see a bit of a drop there. Now, the latest model from the University of Virginia says that we have already peaked in terms of COVID cases. They say that we will see fewer than 1,000 cases a day by later this fall. It says by October we could be seeing fewer than 1,000 cases a day. But that could all change should a new variant emerge. So something still to watch in that UVA model. But if it holds up, we could be back in the area where we were back in March, fewer than 1,000 cases a day. Dan Kennedy, 13 News Now.
Virginia Attorney General Jason Miyares joins a growing list of states suing the White House over mask mandates. The 22 attorneys general argue the ongoing travel mask mandate infringes on each state's ability to enact its own public health rules. In a statement, Miyares said, quote, "The CDC mask mandate on public transportation like air travel is obsolete and no longer necessary, not to mention a clear example of federal overreach."
Fewer Virginians are getting COVID-19 vaccinations. The state health department says around 4,800 doses get administered each day, but only 82% of Virginians' population have at least one dose. When it comes to being fully vaccinated, it's even less, at 72%. Data also shows only about 60% of people who are fully vaccinated have gotten a booster shot. Now, a recent study highlights the importance of those extra doses. Janet Roach picks up our team coverage to explain what the findings could mean for you.
Vaccines have helped the U.S. and the world mostly return to normal during the COVID-19 pandemic, but researchers say the shots may not provide the same levels of protection for everyone. Now, a study from the Cleveland Clinic shows just how big that difference can be. The researchers found vaccinated patients with cancer had a 24% higher risk of breakthrough infections than those without cancer. Hospitalization and death rates were between 7 and 14 times higher. The findings highlight the increased risk people with compromised immune systems face even after vaccination. But doctors say boosters make a big difference. Researchers stress the importance of the CDC's recommendation that vulnerable people receive an additional booster vaccine 4 months after their prior dose. With this Medical Minute, I'm Janet Roach.
And you can get your COVID booster shot or your initial doses in Virginia Beach tomorrow. The city's health department is holding a free clinic. It runs from 4:30 to 6:30 p.m. It's at New Light Baptist Church on Indian River Road. The clinic will not have vaccines for kids under 5, but you don't have to make an appointment.